Lately, there have been a lot of people talking about the pelvic floor, and I'm here to tell you that many people really do not have a good understanding about what the pelvic floor is. My name is Dr. Brooke Kolisiak. I'm a pelvic physical therapist who is passionate about educating women about their pelvic floor health. And today I'm going to tell you the 5 tips that every woman needs to know about her pelvic floor. Tip number 1, what is the pelvic floor? The pelvic floor is a group of muscles on the bottom of the pelvis. They go from the pubic bone in the front to the tailbone in the back. Think of it like a hammock or a bowl that kind of spans that area. It is a group of muscles that's collectively known as the pelvic floor, and this group of muscles has several functions. Unfortunately, most people think it's just about doing a Kegel exercise, which is a contraction of the pelvic floor, but these muscles do so much more than that. One of their main functions is being a bowl that supports the pelvic organ fruit. So our bladder and urethra, our uterus and vagina, and our rectum and anus are the pelvic organs that are supported by the pelvic floor. And if we don't have a supportive pelvic floor, then unfortunately the fruit can fall out of the bowl, and that's known as a pelvic organ prolapse. So these muscles, like I said, are a group of muscles located at the bottom of the pelvis that work together to help support the pelvic organs. And in future tips, we're going to tell you more about the other functions of the pelvic floor. Tip number 2, the pelvic floor does not work in isolation. Like I just said, many people have heard of the term Kegel exercise, which is a contraction of the pelvic floor. Think about squeezing like you're trying to stop the flow of urine or gas or hold back pee. That contraction is one movement that the pelvic floor can do, but those muscles also need to be able to relax, to stretch out, to allow for a bowel movement or a baby to exit. And more importantly, those muscles need to coordinate together with other muscles in the area. So think about your trunk like a soda can. The pelvic floor is the bottom of the soda can, the diaphragm's the top of the soda can, then we've got our abdominal and back muscles that are the sides of the soda can. And all of these muscle groups need to work together to help monitor and maintain proper pressure and stability in the core so that we can move our arms and our legs and have a nice, strong foundation for us to move off of. So it is very important that these muscles coordinate together with other muscles. And when we're thinking about training the pelvic floor, we want them to work together with other muscles. It doesn't do us any good to just sit there and do a bunch of Kegels and hope that that's going to help our pelvic floor issues. Tip number 3, bladder leakage is never normal. Let me say that again. Bladder leakage is never normal. It can be common, but not normal. Many women, as many as 1 in 3 women, will experience bladder leakage at some point in their life. And that's why a lot of people just think it's a normal part of aging, or it's normal after we have our babies. Honestly, a lot of doctors will tell women that this is a normal thing, and when it's bad enough, just let us know and we'll do surgery for it. I'm here to tell you that that is a bad option, that there are so many other things that you can do to help with your bladder leakage. And it starts with making sure that this core canister is working well together. So if you are experiencing bladder leakage, do not let your friends, your doctors, your family tell you that this is just a normal part of aging. Do not accept that you just have to buy the latest and greatest pads. There are things you can do to help fix your own body to make sure that you are not leaking with urge, leaking with activity, leaking with cough, laugh, or sneeze. There are so many different things that you can do to get to be leak-free. Tip number 4, every woman should know about her pelvic floor. Healthy pelvic floor muscles are related to healthy bowels. So if you are having bowel issues like IBS, constipation, fecal leakage, or inability to hold back gas, this may be a result of your pelvic floor muscles not working the way that they should be. So there are many things that can contribute to those issues I just spoke about, but it is important that you get your pelvic floor muscles evaluated to see if they are part of the issue. Because if your pelvic floor is affecting your ability to have a good bowel movement or to hold back a bowel movement, There are many things that you can do to make a change with this. Specifically, as it relates to constipation, if you're dealing with constipation, that can also be affecting the bladder as well, because if your rectum is constantly full of poop, that's going to push forward on your bladder and can irritate the bladder, causing urgency, frequency, and leakage. So we want to make sure you get that entire area evaluated if you are experiencing bowel issues. Tip number 5, every woman should know about her pelvic floor. Sex should not be painful. It should be a pleasurable act. So if you are experiencing pain with intercourse, there is a chance that your pelvic floor muscles might be involved with this. The tissue may be too dry. The pelvic floor muscles might be tight and spasmed and not relaxing the way that they need to be, not allowed to stretch the way that they need to be. There might be scar tissue that's limiting how things can move and stretch down there. The good news is that if you are experiencing any of these issues, there are things you can do to get yourself back to having pain-free intercourse. So don't just accept that this is possibly the norm. You can definitely make a difference in what's going on, especially if you go and get your pelvic floor evaluated. So there you have it. Those are the 5 tips every woman needs to know about their pelvic floor muscles. Did any of them surprise you? Many people are surprised to know that the pelvic floor muscles have an effect on our sex life, on our bowel function, on our bladder function, and even on how we move and coordinate our muscles in our trunk throughout the day. So if you were surprised by any of these, don't get down on yourself. You're in good company. That seems to be the case for a lot of people. I hope you learned that a lot of these issues are common, but not normal things that women should experience. And hopefully now you have the understanding that there are tips and tools and resources out there for women to make an effect on these pelvic health issues. So the number one thing I can recommend is to partner up with a pelvic physical therapist. At Legacy Physical Therapy, we like to work with our patients on an annual basis to make sure that their pelvic health is staying optimal. Think of it just like going to the dentist for preventive care. We want to think about the same thing for the pelvic floor area so that you can have optimal pelvic health throughout the lifetime and not end up dealing with any bowel, bladder, or sexual dysfunction issues. So if you have questions, drop them in the comment or watch some of our other wonderful videos about our various pelvic health topics to help get educated. And if you need help, don't hesitate to reach out, because partnering with a pelvic physical therapist can be your best next step. Thank you for watching our video. We hope you found it informative. We put out weekly content on pelvic health topics because we want people to be able to optimize their pelvic health throughout their lifetime. Make sure you like and subscribe our channel so that you're alerted when our next video becomes available.